Hello and welcome to our Friday webinar. We are on with Lisa Bono. Welcome, Lisa.
Hello.
How's it going? I see four of your flock members behind you here. You wanna give us a little bit of an intro? Who's who again?
Yep, let me just get my way back to Zoom. Okay, so we have Sterling, that's right here, right behind me. We have Sammy. No, wait, that's Emma back there. Yeah. Then we have Sammy right here. And then Sydney's over here. So I've kind of found out where everybody has to be to keep them quiet so they're not screaming during the webinars. So
Wow.
hopefully this works.
Where are they in their day, like their routine right now? Are they like they ate, they're just preening, or what are they what are they up to?
Yeah, right about now. I mean, they usually take a nap between one or two. And then usually right about now, they'd be playing with their toys and chewing on things. And it looks like pretty much everybody's preening. So
Yeah. That's funny. It seems like if one starts to preen, like it's like a whole flock thing, like, right? It's
yes.
But the same with they start playing with toys. Does one if one starts playing with the toys, do all of them like start like it's playtime or is
Yeah,
it?
it depends. Like Sammy, it comes down to how they prefer to play. For instance, like Sammy will play on the bottom of her cage in the corner.
Mm.
I could have a toy hanging up in her cage for 6 months. But if I put it down on the floor in a corner, she'll have it gone in a day. So that I've learned through the years, that's just where she prefers to play. So if I have a good toy down there, she can be down there most part of the day. It's not hormonal. She's not doing anything like that. She is simply tearing the toy apart. Now, Emma, she'll play just a little bit. She can have a toy in there for a couple weeks, regardless of where I put it. It's just when she's in the mood.
And when you have multiple birds, we have a flock. It seems like if one bird doesn't like a toy and like they see the other bird with it, maybe then they like it after all. And so you never have toys really go to waste. Maybe like
Well, what I do is if somebody usually doesn't play with it, I end up rotating it to somebody else. So, Sterling doesn't really like the palm shredders, but he likes cardboard. Where Emma really doesn't care for the cardboard, she'll really like the palm shredders. So I kind of know going into it, while I will order 5 toys of, or well, now 4 toys of each, it doesn't mean everybody's gonna play with the same one.
All right. All right. If you're just joining us, we're doing day two of the Phoenix Landing Wellness Retreat. So day 2 covers, is it like the Sunday, was it Friday, Saturday, Sunday? Or was it?
Friday night was the meet and greet. We all got together at like a golf course restaurant, and we got to meet, who was going to be there, who arrived early, so they're not sitting in their hotel room or their Airbnb. And then Saturday morning, the event actually starts. I believe they were trying to get people there around 8:30 for coffee, chatting, and then announcements. So.
Okay. Okay. Well, then I think you have a great presentation again, and we can see what went down on the second part of this wellness retreat. And just to raise the hands, I think I asked the last time we did this, if anyone, how many people who are joining us today have actually been to either this wellness retreat or just a bird event in general? Like, let's see, 3 so far. There we go. Or 4. Okay. All right. So just to maybe think about something, think about it now about next year or an upcoming event. So this will hopefully pique your interest. All right, Lisa, I'll let you take it over.
Yes, for what I understand, the next in-person event is going to be in 2 years. That's usually how it's worked. I don't have any inside information. It's just it's usually every other year that they do it. So you might want to start thinking about it, planning, get some of your bird friends together. This is a wonderful, educational, very friendly, welcoming event. So, and there's so many things, because it's in Asheville, there's so many things to do on your downtime. Take a couple extra days and enjoy your time here.
All right.
Okay, so let me get my PowerPoint up. Hold on.
And while you're doing that, just a gentle reminder that we'll save questions for the end and to use the Q&A feature for questions.
Okay, hold on 1 second. It's giving me a hard time. Usually I can get everybody down and I can't right this second.
That's all right.
Oh. All right, I'll have to see what I could do here because it's just giving me a hard time. So let me see if I could just bring that up instead. Probably with the new update.
I know they throw those
The
things out. There you
computer.
go. I see your screen coming up.
Okay, and then all of a sudden you got small. Okay, so that's what I was trying to do. Well, hold on.
Perfect.
Okay, yep, we're there. Now. I'm sorry, everybody. It had to be this new update that we just did. Slideshow. All right, here we go. I'm sorry. All right, so we're looking back now at day 2 of the wellness retreat. There's a couple things I had to clear up from last time. Obviously, my mind wasn't exactly where it was after losing, where it should be after losing Abby. So there was a couple things that just didn't pop into my mind that I want to clear up now. So first off, I was trying to think for the life of me where Dr. Eccles was, and I should know this, and he's in Utah. So, that's one thing I wanted to clear up. And the second thing is we were talking about the pulse electromagnetic therapy. So you can see the little loop that's up there in the corner. That's what we were talking about. I could not, again, for the life of me, try to figure out what they like to use it in conjunction with. And here we go. I thought about it as soon as we got off the webinar. It can be used in conjunction with acupuncture and laser therapy. So if you have a vet that's not just using Western medicine and likes to look into other things, this is something you want to look into. Again, this is something that I'm going to talk over with my veterinarian about Sydney. So now we can actually start the second part. So again, here are the speakers that we saw. It was April 6th and 7th. So this is day 7 or April 7th. So again, I put little hearts to the ones I went to, and I know it's a little hard to see it because my phone wouldn't bring the picture up big enough. So the first one I went to, and you can see there's so many other ones. I wish I could have seen them all. And a lot of them are duplicated, whether it's Saturday or Sunday, or, it might be twice in one day in different rooms. I find it kind of ironic that they have different rooms, like the Kanye room, Amazon room, Cockatoo room, or something like that. And they have an African gray room. And unfortunately, I was not in one lecture that was in the African gray room. So I had to laugh about that. So this is Dr. Rachel Baden, and I might be pronouncing that wrong, but I think I'm pretty close. And she was talking about obstructions, how to diagnose surgical management of ingested and foreign bodies. Now, some of these lectures that I attended are going to be more of an advanced track. And she's teaching other doctors what to look for, how to handle it. Now, there are lectures for all and everybody. So you have everything from toy making, behavior, wild birds, and then meaning in the wild, how they observe parrots in the wild. And then you have the more advanced medical track that a lot of the vets will be going to learn to take back to their practices. So this one, it's Dr. Baden, and she's out in California. So let's see, is this? I'm going to go back for a second. Try to turn your volume up a little bit if you can. My mistake was I was trying to sit near an outlet, which is usually off to the side or in the back. So my computer and my microphones wouldn't go dead, not realizing the volume wasn't always going to be getting back to me. So I have it up as high as I can on my end. So please, if you can, turn it up so you're able to hear it a little bit better. And she's talking about one of her patients that has come in. They're trying to figure out what's wrong. Now, I did not get into personal files that they may have discussed or things they've gone through. I tried to keep it pretty much just vague, but to give you an idea. So here we go. Yeah, I don't know why the video wasn't moving, but I guarantee you she was. So the bird came in and they were talking about initial diagnostics and what they were going to do to try to find out what was going on with this bird. So here, day 2, that is not the bird, that is my Abby, but that is a quick reminder. While a lot of people are taking really super cute photos, which I thought that was, if you look around everything behind her, granted she was on my hand, she's about 5 feet away from everything, but everything you see in that background has the potential to cause lead poisoning. So people have to be aware. I see them putting them in Christmas trees and everything else for these really cute pictures. Please be aware of what's around you. So with day 2, with the client that had come in that was not doing well, these were the clinical signs that they were seeing on day 2 before they did the x-ray. So there was progressed lethargy and weakness, sternoincumbent, which means bird was pretty much on its side or laying down and it couldn't get up, moderate to marked dehydration, and non-ambulatory paraparesis. And that means they didn't have use of their legs. So what they did is they did the little x-ray and this comes through. They have something that is showing up in the x-ray. Can anybody in the chat let me know what you think? Okay, I don't see much coming through, but
Oh, wait, so when it says a bell pepper.
okay, so this
Good
is
guess.
actually, there you go. Small pieces of something that was ingested. After they found out, they did their test. It came up that the bird has ingested something and it had lead toxosis. So typically, when something's ingested that can give lead issues, it can be inhaled as aerosol or introduced through ammunition. Best absorbed in acidic environments. Okay, this is trying to tell you how the bird gets it, what the doctors need to do. And once metabolized, once this is in the bird system, the lead is then distributed throughout the body. So believe it or not, which surprised me, 4% of this can actually be found in the blood and the perfused organs. 2% of the lead can metastasize into or metabolize into the soft tissues. Then the rest shows up in the bone. So after they were trying to figure out what was going on here and what the diagnosis was, they found out that whatever lead happened, it came from costume jewelry that the bird was able to get a hold of. So there are some other things you have to be aware of if you have birds. One of the funniest parts when she was talking about, Dr. Babe was talking about lead and how to keep your birds away and all this. And she says, we really try as owners, but birds. So it pretty much shows you turn your back, you don't know what they're doing, they're curious, their beaks are all over everything. You have to be careful of where they are, what they're touching, what they have access to, and it could be fatal if it's not treated. So these are some of the things containing lead that are commonly found in home environments. some things that you would not think of. I cringe every time I see a bird next to a stained glass lamp or a stained glass window or a sun catcher. I'll usually say something to them about please keep the bird away. I found out decades ago about stained glass and the lead solder because I actually worked in a stained glass store. So I'm always real careful with that. But if you read through this, and again, we're going to go through a little bit quickly because I have a long presentation, you can always go back and review this and see what I have written down. Lead and zinc can also come from cheaply made cages or bird toys. So please be aware of where you're purchasing these things. If you're looking at those sites that may be overseas or whatever, and you can get a cage for $1.98, it's probably not the best option. You want to really invest in good things that last long, that are safe for your birds. So talking about safe toys, you guys have heard me talk about Deb White and Super Bird Creations and Make Your Own Bird Toys several times. And she was there and she was leading a toy making seminar. So I interviewed her because you guys should be familiar with her. So here you go. Oh, let me see. Why is this not?
Nope, I think it will start. Are you waiting on audio? All right. Let's see, are we do you want to walk us through it? Hey, Lisa, I can't hear you. Let's see.
So again, I'm not sure why these videos aren't playing. Let me see. Oh, okay. All right, so now we know that I have to hit another button to make everybody actually move. So these were live interviews. So you heard what Deb said. I'm going to go on to the next one. This one was really a hard a seminar for me or lecture for me. I was actually going to do it on Saturday when Abby was still with me because it was one of the most important ones I wanted to see. But when she passed away the day before, I couldn't do this. So I had to do it on Sunday. I want to thank the doctors for making sure that I was taken care of because they were told if I get up and leave in the middle of their webinar, or their seminar, it has nothing to do with them, but everything that has to do with me. So, and this is actually, I think it's real important for all our Amazon people, our gray people, cockatiel people that end up having more issues with this. So this is all about the heart. And it was actually very interesting because Abby had heart disease. I really thought, okay, so there's a general heart disease, there might be one or two, little things that, side diseases or something, but I didn't realize it's classified into different types of heart diseases. So for everybody out there that's going through this, make sure you pay attention. Ooh. Let's see. Hold on. Okay. So I guess this one is not a video. What I love about a lot of these lectures, first we find out what the disease is, how the heart works and the anatomy, which is fantastic because you don't realize all the things that, you know, we work with our vets, but you don't realize all the things that's got to go back in the back of their minds to try to help us and help our birds. So, cardiovascular disease is any disease affecting the vessels, arteries, and veins, and our heart, and the interaction between the two in the course of the disease. This includes pulmonary vasculature. So here we go. Let's see if we can get her move. Again, please turn your volume up. Let me make sure I got it all the way up here.
So, consider it's the big one. That is a big question at the beginning.
Hey, Lisa, I can't hear it on my end. We can't hear the video.
Did you hear the other ones?
Kinda, yeah. This one, yeah, can't hear it.
Let me see here. Okay. But you did hear the other ones.
Well, I'm not sure if it was on my end. Some of them are, no, I guess, yeah, no, can't hear the videos. You want to walk
If
it?
you
walk us-
want, yeah, if you want, I can walk you through that, or Lisa can. I don't want to interrupt, but I'm happy to as well.
Okay, just give me 1 second. I am going to get out of Zoom, get right back in and make sure that I have all the boxes clicked.
Okay, okay.
Okay? Just
Thank
you guys have fun.
By the way, that's me. When I introduced yourself, Michiko, because you're filling in for Brenda today. So
Oh, sure. Yeah, I'm happy to. So my name is Michiko Berceau. I just do some very, very part-time work for Lafeber with trade shows, and I was asked to come in here to fill in for Brenda today on this Zoom. But I am happy to kind of go over some of that cardiovascular stuff before. Atherosclerosis is really one of the most common cardiac diseases that we see in citizens, and unfortunately, a lot of it is due to an improper diet. And what happens is these birds that are in the wild they have so much flight, they have so much exercise that they are very cardiovascularly fit. And then when they come into our homes, you know, we're not providing that same level of fitness, which honestly, I'm not at that same level of fitness. So I hear you. And then they get some really fatty foods and it clogs up their arteries. And so it is cardiac disease for birds. But Lisa, do you want me to keep going while you look at that video, or do you want me to pause?
No, keep going. I'm just looking. It didn't give me an option like I've seen before. So,
Okay. So yeah,
usually in the beginning, when I sign in, it says join in with the audio and I keep it checked. This time I didn't see that. Again, it's probably probably some sort of update.
oh, and Michiko, real quick, what you have some certifications, so you kind of know your stuff here. What do you?
yeah. I'm a certified veterinary technician. I've been working with citizens since 2007 on a medical basis. I used to work at a bird zoo called the Tracy Aviary for about 10 years, and I studied under a board certified avian veterinarian. And yeah, we're really seeing this disease with birds that are eating a lot of like pizza, French fries, and then maybe too many nuts. And, you know, I would always tell owners, try to break up the nuts. You know, one cashew can be 10 cashews if you cut them up, you know, and offer them as like more frequent rewards. And it's just that pairing of those fatty foods and the lack of exercise, although there can be like a genetic or congenital component of it, it usually is that. But here I am, I have no excuse. I just ate a candy bar when we were coming onto this Zoom, so here we are. And so, and then as far as cardiac disease goes, for the second point of that slide, or the video is we can get something called a dilated cardiomyopathy, and that's when the heart enlarges, it becomes bigger. And if you can imagine the heart like it's a balloon, when it's regular size, it has like a thickness to it, but then when it expands, that balloon skin gets very thin. And so that's what happens with dilated cardiomyopathy, is that the heart gets bigger and the walls get thinner, and it prevents the heart, it prevents it from like pumping blood accurately. Lisa, I don't know if that look on your face is that you found everything. I don't know, I don't want to take up too much of your time.
Can that be reversed if a bird does have that? Can it be like with diet and exercise or any kind of?
No, I don't believe that dilated cardiomyopathy can be reversed, but they can get on medications to help support the heart and make it have to work less hard. And then that other bullet point down on the list, and this was the last thing I saw on the list before Lisa hopped off, was it's called hypertrophic cardiomyopathy. And it kind of is it's a little bit, it's still dangerous. It kind of is a little bit of the opposite of the dilated cardiomyopathy, in that the heart muscle, because the heart is a muscle, it thickens and it becomes so thick that the chambers that hold the blood, the little chambers of pockets of blood, now become smaller. And so you have all this blood that's in the body, and now they're in these smaller chambers, and that increases the blood pressure. And that's going to lead to some cardiovascular issues. It's going to be, that bird is going to appear less fit because the pressure in its cardiovascular system is so high. And there's medications to help with that as well.
Wow. Is there like is this like something that typically hits birds like middle age, so to speak, or do you see it all ages?
It can happen to really young birds, or it can happen to older birds. And it can happen to birds that are on a perfect diet. I don't want to, I would never say like, oh, this bird has this disease, it was on this horrible diet and horrible husbandry. Like, absolutely not. It can happen to any bird. It's just that the diet, the husbandry, the exercise are components that factor into these birds getting it at a younger and younger age. And because all of our citizens are such long-lived species, I would get calls about people, oh, I have a very old budgie, it's 4 years old. And I'm like, that's not an old budgie. These budgies can live a really long time. They can live into their late teens. Yeah. So there's two of my older Pioneers who both came to me as older birds on several medications for their hearts. Absolutely. And I'm glad that those owners took the time to take your Pioneers to the vet and get them on those medications and extend their life and their quality of life, because these are just such wonderfully intelligent birds and we love having them in our lives. But absolutely. So they're probably on something like a benazepril or a vetmedin or something like that. But yeah, sorry.
That's okay. So as Lisa gets, sorry. But anyway, maybe another question. We'll just got to do like a little spontaneous question and answer. So just if your bird does have any of these cardiovascular issues, you don't want to like just dive straight into like hardcore exercise, right? I mean, like,
definitely not. Yeah, let's get them evaluated. Let's see why. Let's do a chemistry and see where their sodium's at. Like, we really want to pinpoint why with an X-ray and an ultrasound, because if you put them on the wrong medications, that could go the very opposite way for them. So we definitely want to get it diagnosed.
Okay. I'm always curious when birds are diagnosed with issues, like how long it takes to diagnose, like let's say you bring them in, is it like you bring them in that day, this is what your bird has, or like we bring them in, you gotta do blood panel, we gotta do all this other stuff, like the time frame, like what kind of time frames do we typically work with when we're trying to diagnose something like this in a pet?
That is such a good question, Laura. Like, It's hard because you have a patient that's coming in and your exotic veterinarians are so concerned with this patient's stress level. Nobody wants to have a patient not leave the hospital that day. And so because the stress really exacerbates the heart problems, we really want to take it one step at a time with these birds. We want to provide them with anxiolytics that are going to calm them. Let's give them some gabapentin before they come in to help calm them. Let's give them some midazolam when they're in the clinic to help calm them. And let's make this experience not traumatic for the bird. Is it going to be a little bit traumatic to go to the vet? Yes, always. I don't like going to the dentist. Birds don't like going to the vet, and that's going to be, they're not going to like it. But we can make it an experience that's not so traumatic that the bird doesn't leave the hospital that day. And that's what we all want to avoid. So you're going to talk to your vet about getting on some anxiolytics, bringing that bird in, and we're going to take the time and the care that bird needs to get seen. And that might start off with a physical exam, a stethoscope, listening to the heart. Does that bird have a murmur? How does the heart sound? And then it might go to x-rays, and in the x-rays we're looking for the cardiac silhouette. Is it enlarged? Is it small? What's going on? And then finally there's going to be an ultrasound that happens, and the ultrasound is going to look at the valves and how the valves are pumping. And a CT might even be recommended. If you're going to an avian specialist or a specialty center, there might be a CT involved. And Laura, Lisa, I don't want to take up too much of your time if you want to get back to your slides, because I think I pretty much read what the video was saying too. So anyway, it could be a few visits before we really find out, but we want to make sure that you keep your bird,
Yeah.
For the life of me, I cannot find the button for any kind of audio, but Laura, you also have me disabled, so you have to.
I have you disabled? Oh, because
Yeah.
you bring back in. Okay, I'll make you co-host. Sorry. Don't want to disable. Okay, now you're co-host.
Okay.
I mean, if worse comes to worse, we could just do without the audio. We got the slides, so it'll have the information on the slide, right? A little bit.
Yes, so let me get back to here and let me see.
Someone just said a bird loves going to the vet. Wow. That's awesome. We'd love to know how you got to that
I
point.
love that. I honestly have done
Reinforcement.
a lot of good work to make sure that your bird has a comfortable time at the vet, and I think that's so wonderful.
Wow. I wonder then if there's a difference between going to a bird only vet versus like an exotics vet, or one that might have cats or dogs that could stress your bird.
I think that everyone on this webinar would agree that there's a huge difference, between not having dogs in the clinic and having dogs in the clinic. And I have 4 dogs and I love my dogs very much. But guess what? I, would never dream of bringing them into a place with birds, because I think that's just a big stressor, and of course your birds can be used to your dogs that you have in your home, but I think other dogs would be, it's very stressful for birds. And anyway, sorry, I'll let you get back to.
Thank you. Totally appreciate it.
Let me see if I found something.
Okay. All right.
Split them up.
Hey, I can hear that. There we go.
Okay.
Right. So I think of them in.
So if everybody can hear it, what I'm going to do quickly is go back to the important ones here. Let's see.
We did some lab work, again, looking for.
Yes.
Can you hear this?
Evidence of infection. How are his kidneys and liver doing? Chemistry count was normal, but on his blood count, he did have a moderate anemia. So 25% is a reasonably solid anemia for a parrot. But he was showing regeneration, meaning his bone marrow was trying to replace those red blood cells. So I said, all right, quite normal, but we seem okay. Let's see x-rays tomorrow.
Okay. So then we did the lead, what they found, where it came from. If you didn't hear Deb, let me do this one.
I'm here with Deb White of Superbird Creations. You guys hear me talk about it all the time on my webinars, and her sister site, Make Your Own Bird Toys. Right. So I would like to know what brought you here today.
Oh, it's just such a great honor to be asked to attend one of these wellness retreats and expose people to making toys.
stuff.
For their own birds. I mean, it's much more economical a way to ensure that birds get the level of enrichment they need. Especially with people that have lots of birds, it's very expensive to buy bird toys. Certainly, as a manufacturer, I don't want people to stop buying my bird toys, but I've had birds in my life for over 65 years, so it's about them first. It's an essential form of enrichment. And whenever I get the opportunity to get out and teach folks on how they can make toys for their birds using supplies either they buy or common items around the house, or things they can find in grocery stores, I love to take that opportunity to share that.
Well, your lectures are they're a lot of fun, learning how to put everything together, and it's taught me a lot because I've sat into them quite a few times.
Well,
I'm usually in the back, so I'm like quiet, but it's a lot of fun. So if you guys ever get a chance to sit in, make some toys, go to our website. It's a lot of fun. You can make your own bird toys, and thank you for speaking with me.
Thank you. I appreciate it.
Thanks.
Okay, so now we will get into, we'll get my notes out here. Okay. This is Dr. Crystal Schulman. And
so I typically split them up, and this is hard because these interact, right? So I think of them in these two categories, but it's not that simple, looking at this. So atherosclerosis is the big one, and we'll talk about what that is and how it manifests here in a minute, but it can progress to heart disease and congestive heart failure. You can get low blood flow to the rest of the body, which is hypoperfusion. You can get increased blood pressure because the heart is going, oh my God, get the blood out of there. And then you can get ischemic stroke, so that low blood oxygen, stroke-like events. You can also get narrowing of the vessels, which is this is the fancy way to say that, is those arteries get narrowed and cause those problems. And then it can progress to overt cardiac disease, and you get mainly two types. You can either get hypertrophic, where the walls get really thick, or you get dilated, where the chamber gets really dilated. So depending on the pressures of the system and how long that problem has been going on, you get variations on those two. Issues with the valves themselves are possible. We don't diagnose this very often, but it is a thing. And we also, this comes into play, pericardial diseases and effusion come into play more when you're trying to stabilize a bird, but there's a lot of reasons for that as well. It can be secondary to heart failure, but you also need to be looking for infection, cancers, bleeding disorders, toxins, things like that. So
let's see, this is another one.
failure is not a primary disease. Congestive heart failure is the consequence of structural or functional abnormality of the cardiovascular system when it just can't anymore. The heart in the course of the day deals with your different hydration status, your different stress levels. If you went for a jog, so the heart is pretty good at dealing with what you give it until it's not. So heart failure is when the heart goes, oh crap, I've exceeded my ability to operate within these limits. And these are the things that I end up doing. So that's what results in, you deposit fluid into the lungs, you're leaking it around the heart, you're putting it in your belly or in your liver. So this is the failure of the normal kind of homeostatic mechanisms. And we'll talk about how you manage this in a little bit.
Okay.
Failure is not.
So why does this disease occur? I mean, I had a lot of questions with Abby, considering I have all these birds and they're fed the same things and the same toys, same diet, same everything. But why was she the one that was affected? So you have the species predisposition. So you have your cockatiels, your Amazons, and your African grays. It could come from genetics, which probably was Abby's issue. You have your dietary or nutritional intake and what the birds are eating. Then you have your environmental and your husbandry, and then you had age-related changes. So on my gray board that I have on Facebook, I have a lot of people that are having issues with their birds and heart diseases and heart-related issues. So, it seems like no two are alike that I'm dealing with or hearing of or trying to comfort people with. So the prevention is gonna be your good diet. You wanna make sure you're following your veterinarian's lead, your omega-3s and the fatty acids, and then you're gonna have your exercise. Exercise is very important pretty much for every living creature that is out there. And then I'm just gonna kind of move along because I lost so much time with the video. This is John.
Okay, I'm here with John, and he is from the University of Georgia. He is a second-year vet school student. So why did you decide to come today?
So I decided to come today because I thought that this was a great introduction into avian medicine, which is something that I want to get passionate about and get excited for my future clients who want to come in and have a veterinarian that is just as excited for their birds as they are for their own pets.
And we need you. So as an owner, thank you for doing this, and we wish you all the best, and we hope to see you around a lot.
Appreciate it. I love this conference. It feels like a close-knit community. It's great.
It's great. And you got a lot of great mentors to learn from here. So thanks for coming.
Appreciate it.
All right.
Please note, I'm not wearing the same clothes 2 days in a row. We couldn't get the microphones to work on the first day. So all my interviews are going to be in between seminars and on the second day. So here is a good one as well that I really needed to sit in on because a lot of people come to me for behavior issues and they'll say, my bird is doing this and why is it doing this? And Dr. O, you never get tired of listening to her. She's got a lot of knowledge there and she loves to share. And so this helps a lot to try to explain to people why behavior is not just A or B. There's a lot of other things that come into play. So this is going to be how disease affects behavior with consideration of the gut-brain axis. See, is there a video for that? No. Okay. So this was actually towards the end of her lecture, but I kind of wanted to make it a little bit more understandable. So this is pretty much just explaining how everything inside the bird, whether it's going to be down from the feathers and the philophones and, the gut to, everything is going to lead back to the brain and decide how the brain is going to react. So there's plenty of diseases that can come into play that are going to affect behavior. So when somebody comes to me, the first thing I'm going to say is, have you been to the vet? What tests have you been done? A lot of times I'll ask if I can review them to make sure the tests that I'm looking for are on there. So disease can play a lot into behavior. And this is important for the people that have been diagnosed with AGN or ABV. Right away, they immediately think it's a death sentence, and it is not. So I immediately shared this on my Facebook page to show everybody who's dealing with this that what they've been told or what they think from the past, everything's evolving and changing, and it's important for them to know that, with the right care, birds can go on to lead a very good life. So, age will also affect behavior. I see that with my own Sterling. He's going to be 42 or 43. He moves a lot slower. He might be a little bit, I'm going to use a label, cranky, compared to the other guys when it's time to come out, when it's time to get up, because he's aching. Also, the memory comes into play here because, he might be trying to figure out what he's supposed to do to get from point A to point B, and whether he's got to climb on this perch or this perch, it might take him longer than, say, a younger bird. Hormones, we're all real familiar with this, especially right about now. So hormones, can affect behavior. And there's certain things that, you don't want to do. We've talked about it before. And again, please go back through the video and read everything that's in here, because it's important for you to make sure you got it on your checklist when you're trying to work on issues with behavior. Stress is another thing that comes into play with behavior. And people don't realize there's so many different factors that come up to this. It's not just because your bird is not stepping up. It's why is he choosing not to step up? So again, here are some different things. You have high stress, can lead to issues. You got environmental factors. Things are going inside the house, outside the window, strange people being around, lack of sleep. And here we go.
And predation, that's not going to work. So they can see in the near ultraviolet light.
Okay, so what she's talking about here, right quick, I didn't realize I cut off the beginning. She's talking about the way birds can see. Okay, they see much differently than we do, and this kind of explains it a little bit better. Start from the beginning.
That's not going to work. So they can see in the near ultraviolet light spectrum, and so they can fly by and go, oh yeah, that tree's, those are ripe. I'm going to zoom down there and eat that, but I'm not going to go over here because they're not ripe yet. So those are some of the things in this alerting of the brain and making the brain with the feathers and the flying and the movement of the feathers with the wind, all that's going to help from a behavioral perspective. Okay, so and predation.
All right. So that's a good recap of how everything comes into play with behavior and all the different things we have to think about to try to help you and for you to try to help your bird. So here is another interview, and Laura, when you get a chance, please let me know how we're doing on time.
Okay, I am here with my friend Angie. She's actually the creator of Paco Birds, so you guys know that I'm always speaking about it, and she's been great with all my webinars. So Angie, why did you decide to come here today?
Not just today, this is the third time I'm here, and this is a great organization. Phoenix Landing is a great organization, and I'm here, number one, to learn. And sometimes you don't get that opportunity. And even though we are making pet carrier, but a lot of it, when you become a bird person, you have to know more to help your customer. Age, what do you do, what kind of activity, situation, disability. Right. And sometimes we talk about what kind of perch and all that, what kind of conditions of the body.
Correct.
So you know more than that.
Right.
So this is, if you want to be a good bird person, you have to know more, food and everything. And
right.
If you really mean out there to help the parrots, right?
Right, exactly.
Yeah.
So this is the third time you've been here, right?
Yes, it is.
Another veteran. So I'm happy to see you. Thank you for everything.
Yeah,
and you enjoying the conference so far?
Very much, very much. I also recommend people, anybody who is a bird owner, if you want to know more, you can have bird for 20, 30, 40 years. And the first time you come here, you kind of feel like, do I fit in and all that, honestly. And second time, you warm up to it. The first time, actually, you say, you know what, I'm actually thinking I'm learning something,
right,
honestly.
Right, yeah.
Because sometimes things doesn't come to you until later on, and you kind of connect your emotion with your brain. It's just like bird.
Right, exactly.
Yeah.
So I'm glad you're here. Thank you for coming.
Thank you, Lisa.
And thank you for everything.
Thank you.
All right.
All right.
As you can see, I'm sitting here smiling with a lot of these interviews because it's the first time I'm watching them since I did them. So the next lecture I was in was with Dr. Brown, and she wanted to talk a little bit about mushrooms being medicinal and a review of Eastern and Western use. So I'm going to kind of go through the beginning of this rather quickly because I don't know how we're doing on time. But this is kind of explaining why she wanted to talk about mushrooms and how some of the vets can incorporate them into some treatments.
Different jobs, and we all have something to offer, and when we put it all together, that's when magic happens. When one person in one discipline starts talking to another person in another discipline, and they start connecting some dots and making things happen. And so that's what I wanted to do with talking about the mushrooms.
Okay, so a lot of the veterinarians are now not only using the Western medications, they're also looking into some more of the Eastern type medications that are going to help, that are more you know, I guess traditional, maybe more holistic, maybe I'm not saying that correctly, but there's ways to incorporate different things in besides just the hardcore medications that we're giving. So this kind of explains the two different ways that medication and traditional stuff is being looked at, and how if some of the veterinarians want to incorporate some of this in there, that they can. So for people that don't really know, the Eastern medicine is going to be more of traditional Chinese medicine and the Ayurveda techniques, which is a system of traditional medicine native to India. So Eastern medicine practitioners diagnose the disease by examining the entire body with a focus of imbalances in the person, where Western medicine makes more of a diagnosis according to a person's symptoms. Eastern medicine is a significant emphasis on prevention, and while Western medicine, some of it does do that, it generally focuses on medications. So you know, when you go to the doctor, you tell them your symptoms, they tell you, okay, they're gonna give you another medication, this is what you do, because this is what's been the proven way that it's been helping. So you're given medication, you go home, you recover, or you know, with other illnesses that might last you a lifetime, they help you cope and get rid of the symptom. But with the Eastern medicine, they also do acupuncture, they do herbal medicines, dietary therapies, they do Tina, a form of therapeutic massage, and then you have Qigong and Tai Chi, which are meditations of the mind. Tai Chi is a little bit more outward and movement, and then the Qigong is going to be a lot of inner exercises with your mind, and then some of the motions with your body. So the medicinal mushroom options, what we have to do first is for everybody, and I can't stress this enough, okay? This lecture is not about somebody going out and hunting in the woods and finding these mushrooms and thinking it's okay to give them to your bird, because that is dangerous. This lecture was for veterinarians to learn what type of mushrooms may be good to incorporate into your therapies with medications. So they're not talking about handing out a mushroom to a bird to eat. This is all a tincture or things that are put together that you can add in. You have to use caution when selecting mushrooms. You have to focus on where it came from, where this tincture comes from. Not all mushrooms are created equal. The efficacy will depend on what parts of the mushroom are used in the supplement, and it is only considered a supplement. It's not really considered a medication, so that's why it's incorporated. Same thing in my first lecture, we talked about the loop with the acupuncture and the laser therapy. These are all things that can encompass and help your animal, you know, and bird help to get better. So again, we learned the anatomy of the mushroom. I will never look at mushrooms again the same. I know that through the years, my siblings all hate mushrooms because my mother cooked with them a lot. I happen to like them. So through the years, I have gone out and bought my sister different mushrooms, whether it's a Christmas tree ornament or whether it's something for the yard, simply because she doesn't like them. So now when I'm picking out stuff like that for her, I'm going to be thinking about these slides I have right here, because mushrooms are so much more than I thought. So you have your history of when they used it. It's been back, mushrooms have been consumed since earliest recorded history. Again, this is humans. This is not, you know, saying birds have been ingesting them. The ancient Greeks believed mushrooms provided strength to the warriors. The Romans perceived them as food for the gods, and the Chinese treasured them as the elixir of life. So This is a little bit, again, this is telling you what parts of the mushrooms are good for the antitoxins, antitumoral, anti-inflammatory, antimicrobial. That's, this is what the vets have to look into and figure out what would be good and why it would be good for your birds. So we learned about all different types of mushrooms. A couple of them you could see that have little highlights. For instance, they work well for respiration. Some work great for reducing LDL cholesterols. So this is something your vet would look into and decide if they want to incorporate. This is mushrooms at a glance. What type of mushrooms help with certain things? And I was surprised to see immune support, nerve support, digestion. I was surprised. I do know way back when I've known Dr. Brown for 20 something years, and I had a very sick bird with aspergillosis. And I remember back then she advised, along with another vet, Dr. Wade, Laura Wade, up in New York. They said, you might want to try to incorporate this into the diet. And I thought back then, I'm thinking, oh, that's crazy. You can't add that in there. It's mushroom. I did end up ordering what they suggested because I was willing to try anything. Sadly, I can't report on how we did because sadly he passed away before we got it in. But even back then, Dr. Brown and Dr. Wade were talking about this 20 something years ago and how it could help in addition to medications. So this was just simply me sitting there taking notes to show everybody I was awake and taking notes. And then this is when you want to use a mushroom supplement. You could have different things. You can use it for different diseases. You could use it for bites and trauma, stress issues, bacterial and yeast infections. There you say during an illness when it occurs that birds are susceptible to other diseases. There you write on there, you have African gray, aspergillosis. That's probably why it was suggested to me for all those years ago. It's not something you want to use continuously. You want to give the system a rest from time to time, is how Dr. Brown thought it was really the best what she has seen. And then this is going to be one of the last interviews. This is my newfound friend. He did his best to keep me laughing the weekend.
And here we are with Mike. He is actually the go-to guy for Phoenix Landing for the event. So, Mike, I'm wondering, what made you become involved with Phoenix Landing?
It was actually parrots, because one of the depressing parts is we've bought our first parrot from a breeder, and we realized we didn't like it.
Okay.
So trying to find the right bird for the right person, we actually figured fostering to adopt would be the ideal thing.
Okay, that's very good. And I've had both ones that I bought and adoptions, and I'm always pro-adoption. And
awesome.
So, and you're from Maryland?
I'm from Maryland. There's a lot of people that are from Maryland that have birds, and they think that they know how to treat their birds, which is something that's difficult for me because they tell me what to do, they tell me what to get, and they look for items and situations as saying they know more than anybody else.
And just so everyone knows, the main part of Phoenix Landing is located in Asheville, North Carolina, but they have different states and different volunteers. We have Jacksonville, we have Maryland, we have Virginia. What other ones?
It started mid-Atlantic, and it's actually growing to the eastern seaboard.
Okay,
and
good.
Recently with this event, we're actually going up into New York and New Jersey.
That's wonderful.
Which is wonderful.
Yes.
And it's one of the things to where Phoenix Landing is a rescue organization, but we're that type to where we try to get the bird owners to actually learn to work with their birds. We don't do any advertising. We don't try to influence the bird owners on what to do. We try to make it nice and appealing for the freedom of the animal.
Right. And it's great that you guys are expanding. I would come down here from New Jersey every year. When we were looking around to move south, I was thrilled that I was going to be in this area and be able to just drive in an hour. So, you guys do a great event. He's been busy taking goofy pictures of me like the whole time. So we got lots of blackmail there. So I want to thank you for sharing with us.
I appreciate it, and I also appreciate what you guys have been doing for us, because the main word that we look for is outreach. It's the key word to say everybody has the right intention, but as we get together, it's like, let's also do the right approach.
Right.
And that's where I support you, and I appreciate you for being here and listening to me today.
Thank you very much.
Thank you.
So I had no idea he was going to be doing his little thing with holding up the bag. So he was he did a great job. And then we're coming to the end. And this is actually the question and answer period. It's like the last part that you can get in there and we can talk about anything, regardless if it's been a lecture or something we have questions on. And so these are all the speakers that came from all over the United States, and even some of them out of the United States. And hopefully next year or 2 years from now, I'll be able to sit in some more lectures that I wasn't able to hit up this time. And we are going to give Dr. Stahl the last word.
I think we can all feel the amazing energy here, and I mean, this group of speakers has just been fantastic. I've attended a lot of the lectures myself and gotten a little bit of taste of what everybody had to offer, and I've just been blown away by it. And I've been doing this for 35 years, so I learned a great deal. And then talking with all of you, I feel like we all just jive so well. And I think what I love about what Ann and Susan have put together is just the need to bring the medical and the avian community and the behavior and the wild aspects and the conservation, that all needs to be melded together, and come together as a group with energy and with really the desire to do a better job for birds, right? Both in captivity and in the wild. So it's been perfect for that. I think we can all agree, right? Yes. Yeah. We're all energized, and that's what we came here to be. So thank you, Ann. Seriously, thank you so much for all you do. We appreciate it. I think we can.
All right.
So, real quick, I want to thank everybody who's reached out to me, sent cards or emails about Abby's passing. I appreciate every one of you. I did see your chats, and thank you for thinking about us. Again, if you're able to come in 2 years, I'd love to see you there. And you get some more pictures of all of us on the webinar that are there. And again, thank you for being here.
Aw. Thank you, Lisa, for powering through the technical difficulties. We got it up and running, so more power to you. If you have time for a really quick question, we had one question I just kind of wanted to throw out there. Yes. If you have time for it, and that was going back to the lead. Do you know what kind of cloth contains lead? That was a question.
Let me see if I have anything in my notes here. Hold on.
Yeah, I'm trying to rack my head on that too. I'm thinking like an iron board cover. I don't know. Who would have that? No, I don't know.
No, I'm not seeing it in my notes. That was on one of the slides, correct?
I believe so. Someone suggested sparkly fabric, but I guess we could look, investigate that, and maybe throw that out there just wondering if you knew on the top of your head.
Yeah, it doesn't mean that I can't reach out to her and ask her.
Okay.
So I will attempt to do that. I know they're going to be very busy. So one of these days, somebody replied, maybe tablecloths, decorative tablecloths, the runners, maybe something like that. That was very good. So
yeah. Maybe stick to cloth for now until we know. That's all right.
Right.
So wait, okay, so yeah, like you said, maybe start saving now. 2 years will come quicker than you know, but you can start saving now and have a spectacular bird-centered vacation in 2 years from now. So
yes,
with your people, with your flock together with other bird people. So I have to do today's giveaway winner real quick, and I hope you're still on. Okay, so today's giveaway winner is Ann Morris, congratulations, Ann. I think we're going to be sending out some tropical fruit nutriberries as well as another Lafeber product of your bird's choosing. So congratulations. And real quick, we have, let's see, we're already mid-May, but we're going to be back in June 7th, with Pamela Clark, and I believe she's doing a behavior Q&A. So if you have any baffling bird behavior, which I'm sure a lot of us do, because our birds constantly baffle us with their behavior, probably. Join us, and she'll answer some of your behavior questions. So that'll be fun. And I guess that's it. Yeah, I want to just wish everyone a great weekend. Elisa, once again, thank you for reporting on this this great yet important and fun conference, or wellness retreat. I love the a wellness retreat, because that's really what it is. It's a wellness retreat for you and for your bird, because your bird ultimately gets some great takeaways when you go back home on their wellness.
Yes. This has to be the best, conference that you could attend. I mean, after the first couple ones, I actually went home to New Jersey and tried to do it on a very small scale, because that's how impressed I was. And it's so important for us to just share and learn and help the next person.
All right, there you go. On that note, I'm going to wish everyone a fabulous weekend. All the best to you and your bird and your flock. And until next time, stay safe. Bye, guys.
Bye.